Hello and welcome back to a brand new German New Medicine tutorial. I am very excited to cover movement and motor conflicts with you guys today. I'm Dr. Melissa Sell, and I invite anyone who's brand new to German New Medicine in these tutorial videos to watch GNM 101 before getting into this specific tutorial video, just so you have a little background and you understand some of the language and what we'll be talking about today. The information contained in this presentation is intended for educational purposes only. It is not a substitute for professional medical advice. Here are some of the sources I used in the creation of this presentation, if you'd like to check them out on your own. Alrighty, let's get started. So the basic premise of German New Medicine is that when you have some type of health issue, symptom, or change in tissue in your body, other than due to an injury, surgery, poisoning, medication, deficiency, it is due to a specific intentional biological adaptation that's controlled from your brain. These adaptations are initiated by some type of biological conflict shock. So this is a shocking, traumatic, isolating situation that caught you off guard in a moment, and your body set off a biological program to adapt your tissue to improve your chances of survival. So that's the big picture we are dealing with. Now, in GNM, we work backwards. So we look first at the tissue changes. What symptoms is an individual experiencing? And based on those symptoms, we know about the story of what conflict that person experienced. The symptoms tend to indicate whether you are in the conflict active phase or the healing phase. The line can be a little bit blurry, as we'll talk about in the conflict today. So what we want to do is identify and become aware of the conflict source so that if possible, we can resolve it and prevent future symptoms. So a couple examples here of what it looks like to work backwards in this way. First, something like muscular paralysis. This is due to a motor or movement conflict. And this happens, you'll have this response of paralysis during the conflict active phase or the early part of the healing phase. Now, if you're experiencing muscle spasms or twitching, this indicates that the movement conflict has progressed further and you're now in the healing or epileptoid crisis. And so with the knowledge of GNM, we can decode what the body is trying to tell us about what's going on, what's gone on in the past. If a person is having recurring spasms and twitching and it keeps happening, that indicates that they are in a hanging healing where they keep relapsing back into the conflict, many times in response to the symptoms themselves. So with this knowledge of the 5 biological laws and the research amazing work of Dr. Hammer, we can understand what the body is doing and why. Whereas with the conventional understanding, we don't really have many answers for why the body would suddenly go paralyzed or have random spasms and twitching. So with the motor conflict, we are dealing with the muscles, but I wanted to differentiate the difference between different control centers and different muscle functions. So the muscles themselves, there's the body of the muscle metabolism, the trophic function of the muscle is controlled from the cerebral medulla. And this is associated with a self-devaluation conflict, which I covered in a different tutorial video. Now the muscle contraction, so the ability of the muscle to move is controlled neurologically with the skeletal motor nerves. And this is controlled from the cerebral motor cortex and responds to a motor movement conflict, which is the focus of our topic today. But you can see how these obviously are very closely related. They both are related to the muscles. It is common for someone to experience a motor movement conflict and to develop a self-devaluation conflict in response to not being able to move. Here you can read through a list of symptoms and conditions that are associated with motor movement conflicts. And you'll see they're all related to this family of issues having to do with the functioning of the muscles, resulting in things like paralysis, tics and spasms, things that are labeled neurodegenerative diseases. So let's talk about what is a motor or movement conflict. This can also be considered a feeling stuck conflict or feeling restricted. Now, with all biological conflicts, we either experience them in the literal, physical, actual sense, or in a more figurative, metaphorical sense. So an example of a physical, literal conflict would be if a person is being abused, if they're being physically restrained, physically held down, tied down, hands tied, they're unable to move or they're not allowed to move. If a person is in an accident or has a major injury or a fall and they are stuck and they're unable to move due to that injury. This can occur if you're unable to push someone or something away from you. You're feeling cornered or trapped, physically incapacitated in some way. Let's say you woke up in the hospital and you are restrained down to a hospital bed, can create that feeling of being stuck. Also, if you're unable to hold someone, unable to hold them close, that can also result in a feeling stuck conflict. Now, in a more figurative sense, let's say you're not actually physically stuck, but you feel stuck. You kind of are metaphorically can't get away, you can't get out of a relationship, can't get out of a job. You're feeling stuck between a rock and a hard place, two very difficult choices. Like your hands are tied, you're frozen with fear, shocked or stunned, not knowing what to do, you can't see a way out, unable to keep up, feeling held back in some way. And this can also happen if someone you love is stuck in a situation. So even if they are physically stuck, say in a hospital or in a wheelchair, you can experience this biological shock from seeing them go through something difficult. And this is all based on the unique perception of an individual. It's very subjective. So objectively, a person could be going through a situation like this, but not have the experience that sets off the biological program of being stuck. So it's not a one-to-one, if this happens, you're always going to experience muscle paralysis. That's not how it works in German New Medicine. It's very unique to the individual and how they see the world. So let's look at the first biological law, which is the relationship between the psyche, brain, and organ. And so this happens all at once. We describe it separately because we use words and that's how we describe things, but this is something that occurs lightning speed as soon as their senses take in that the person is feeling stuck. They have this motor conflict. Immediately at that moment, there is an impact in the brain and the cerebral motor cortex, and there is muscle weakness or paralysis, a decrease in the nerve impulses being sent to a particular muscle group. And so this, again, it happens all at once, and it's all initiated by the psyche, by the perception of the individual. So in the cerebral motor cortex, the region of the brain that we're dealing with, there is a crossover correlation where the right side of the brain controls the tissue on the left side of the body. Now, a right-handed person, this is very relevant if you're trying to figure out what type of conflict a person has experienced. A right-handed person, if their conflict was in regards to their mother or child, their symptoms will show up on the left side of their body. Whereas if the situation, the feeling stuck, was with regard to their partner, some significant relationship that's not their mother or child, could be a sibling, a parent, or a father, a friend, or someone else that's important to them, it would happen, the issue would show up on the right side of the body. And it is opposite for the left-handed people. Now, again, when we're looking at where is this person experiencing their symptoms, they can experience it all over their entire body. So not just one side or the other, overall, generalized entire body. If they're feeling immobilized or feeling stuck, they can experience it that way. It could just be the legs, the arms, a single arm, a single hand, even a single muscle group, depending on the specificity and the content of the conflict that the person experienced. And so that's how we can kind of figure out, okay, what happened that caused you to feel stuck all over, restricted head to toe, versus a person who just feels restricted in their arm or leg. Now, the muscles that are affected can tell us, again, a little bit more about the nuances of the situation that the person went through. Something with the head or neck, not being able to turn away or look away. This happens with babies when they are in the womb, and perhaps if there's a misalignment in the pelvis or some kind of uterine restriction and the baby's stuck in a position where they're unable to move their head, they might develop torticollis. In the face, a person can experience a losing face conflict, something to do with their personal appearance or some type of horrific embarrassment where they felt like they were made a fool of. The shoulders and back, if you're unable to step aside or get out of the way. Hands and fingers, can't keep a hold of something you couldn't catch or grab in time. The jaw muscles have to do with being unable to bite someone back or speak your mind or snap at someone that you would like to say something to. The arm muscles, the flexors, which bring things in towards your body. That could be due to not being able to hug or hold someone. Able to push something away with the extensor muscles, cannot defend yourself, being restrained, can't fight back. And then the leg muscles, can't run away, you can't get away, you feel rooted to the ground in some way, would affect the leg muscles. Now we will look at the second biological law, which is the law of two phases, which is so important to understand the different landmarks of the conflict, what happens when you're in conflict versus when you are in the healing phase. So here, conflict active phase. This is when the shock occurs. The DHS happened, you were caught off guard by feeling restricted or stuck. At the psyche level, you can't think about anything but this problem. You're not sleeping at night, you're staying awake, and the whole purpose of that is so that you can figure out a solution to this problem. At the brain level, there is a Hammer focus in the cerebral motor cortex, and what's happening on the organ level is a decrease in skeletal muscle nerve function. So fewer stimuli going from the brain to the muscle, resulting in weakness, paralysis, decreased sensitivity, restlessness, fidgeting, lack of coordination, feeling clumsy, heaviness in the limb, sudden muscle weakness. This is also sometimes considered a white stroke, when you just suddenly lose function or lose control of a muscle group. Now, this can happen all on its own without a self-devaluation conflict, or if there's additional atrophy along with paralysis, that indicates the person is experiencing a motor conflict and a self-devaluation. Atrophy with no paralysis means it's just a self-devaluation, it's not affecting the motor function, just the trophic function of the muscle. So let's talk for a second about why the body is doing this. What is the biological purpose? Because remember, the body doesn't do things for no reason. Every biological program, the whole purpose of it is to increase your chances of survival. So what's happening here is when you are feeling stuck, when you are feeling petrified, frozen in fear, hands are tied, your body calculates that your best chance of survival in this particular situation is to play dead. So this means that you experience a situation as pretty hopeless. And so normally, the other biological conflicts, everyone's familiar with the whole fight or flight. Am I going to fight this situation? Am I going to run away from it? This is kind of like another option, which is play dead, so that the pursuer, whoever's after you, will leave you alone, because, a lot of predators will only go after something if it's moving or if it's running because it's alive. And so we want the pursuer, the attacker, to think you're dead, so it'll leave you alone and it'll move on to the next prey. And so that biologically is what is going on. And so when your muscles are, when you're experiencing this paralysis, it's for a reason. It's because of something that you are perceiving as very dangerous or hopeless in your life. So the conflict lasts as long as it lasts, until you get to that point of feeling free. You get free from this restrictive situation. You get free from this circumstance. If you were trapped in a car or in an elevator, you get free, and then you resolve the conflict. Now you're feeling relaxed. Now you're feeling like I'm safe. Everything is okay. Now, conflict resolution can take many different forms, and there are many possible causes for resolution. Dr. Hammer says always the best solution is a natural resolution. So again, if you're trapped, if you're stuck somewhere, getting loose, getting free. If you are in a abusive relationship, getting out of that relationship. that would be the dangerous situation passing or leaving. So now you can truly relax. Now, sometimes it's not always that easy. Sometimes there are things you may not be able to get out of right away, or there might be some time you have to wait. So in that time, you may need to change your perspective of the situation. You may need to have an emotional release or forgive someone or some situation, develop a new understanding of yourself, shifting your priorities, seeing things from a new vantage point. So if this is something that you're struggling with and you just are like, I can't see a way out. I can't see how I can perceive this situation any differently. That is what the Resolve community is all about. It's about supplying you with ideas and tools and resources for how can I shift my perception of what seems like an impossible situation. And so in the program, we offer many different ideas. There are videos and notes and journaling exercises and guided meditations to help you with this process if you feel like you need it. So motor movement conflicts are unique in that there's symptoms during the conflict active phase, like we mentioned before, and those same symptoms actually continue over into the healing phase. And so this can make the line a little blurry when you're trying to determine, is my conflict resolved based just on your symptoms? Because as we see here, although the restoration process is beginning, and you have resolved the conflict in this first half of the healing phase, you're in a state of relief, you're feeling free. However, the muscle paralysis or the weakness, it remains during this phase, and it may even increase during this first half of the healing phase because of the brain edema. So when the body goes into healing, whenever there's healing, there's going to be an increase in fluid and edema in the area that's healing on the tissue level and then also on the brain level. So when there's this swelling in the cerebral motor cortex, there's an overstretching of the synapses, which means that there's still a delay and there's still a disconnect between, you wanting to move your hand and being able to. And so once again, with this understanding, when you understand, okay, this may even persist into beyond when I feel like I've resolved this conflict, having that perspective is so huge, because instead of continuing to be scared or getting further freaked out, or devaluing yourself, you say, okay, this is a normal part of the process. My body knows what it's doing. There is swelling in my motor cortex, and it's slowing the nerve synapses, but this is okay. My body is doing what it needs to do. Another thing that may occur during this time is vision impairment, because again, due to the brain edema, sometimes there might be pressure on the optic nerve. And so it's a lot of times conditions that manifest in paralysis, there's also vision issues. But again, this is fully understandable when you know the 5 biological laws. Now, the epileptoid crisis, this is the height of the healing phase. This is when the body gets to that point of maximum edema. There is a surge, a big squeeze of sympathetic dominance. And the whole purpose of this is to squeeze out the edema and get things reconnected. And so this is when you experience muscle twitches or tremors or spasms, cramps, tics, even a seizure, either localized to a muscle or whole body convulsions. And this is the neural reconnection, sudden reconnection of the nerves once the edema has been squeezed out. The epileptoid crisis typically happens during nighttime when you're really relaxed in the state of greatest vagotonia. The extent of the healing crisis is going to depend on the extent of the conflict itself. So how long was it? How long did it last? Many times you kind of in this moment, in kind of like a micro moment, you relive the conflict. So the original feeling stuck. Sometimes it'll be a dream. You'll relive it. Biologically, this big squeeze occurs, pushing the edema out of the motor cortex. You may have a headache, the spasms, and the muscles. What they're doing is coming back to life. And so how you respond to this event will determine, are you going to feel even more scared and more stuck and self-devalue yourself? Or will you understand, okay, this is a very understandable part of this process, and this means that I am moving through it and that I'm healing. Another thing that can occur here, like we talked about the white stroke on the front end, so you can have a white stroke during the DHS itself, or in this phase during the healing crisis, you could have what is called a red stroke or a hot stroke. Then we move into the second half of healing, which is the parasympathetic scarification phase where swelling subsides and the nerve function restoration completes. And so what happens here is your body is just renormalizing. We're getting back to that normal homeostasis. You're in this feeling of relief and well-being, potentially stressed if you were worried about what happened during the epicrisis, if you didn't know what to expect, or if it shocked you in and of itself, that could begin another round of some type of conflict, which would lead to what is called a hanging healing. And so this is the case with certain conditions where the person has tics, or if they are having tremors in their hands. So they go through and they have this healing crisis, but the tremor itself becomes a trigger for relapsing back into the movement conflict, which causes this hanging healing phenomenon where the person just kind of continues to have the same symptoms again and again and again. And this is something, once you start to recognize, you start to resolve and connect some dots, you can close the loop on this recurring issue. On the brain level, this is very important, and we'll talk a little more about this on the next slide too. The brain area that was affected by the DHS, the area has to be restored. And the way the body restores the brain is with glial tissue. So, with the rest of the body, there's scar tissue. In the brain, the scar tissue essentially of the brain are glial cells. And so what it does is it restores the area impacted by the DHS. And so this scarring can be picked up on MRI and brain scans as these white plaques, which in certain situations, people may have a brain scan and they find the white plaques and they say, oh, this is what's causing your condition, when it is an effect of the biological program rather than causative in and of itself. So let's look at this regarding the brain. The conventional theory is that something like multiple sclerosis, that the body mistakenly attacks the myelin, the protective nerves around the brain and spinal cord, and these damaged areas called plaques or lesions are considered the cause of the problem. And so they say, oh, here's the issue is here in the brain. But from the GNM perspective, it's the neuroglia, the brain connective tissue, has proliferated in specific brain regions to restore the tissue that was affected by the biological conflict. And so the presence of these plaques simply indicate repair work that has been done due to previous conflicts. This region that you can see in this particular image that I have here, it's in the area of the cerebral medulla. And so that is associated with the self-devaluation conflicts, which commonly go along with the motor conflicts. So it is the previous biological conflict shocks that explain the presence of these brain plaques. Now, Dr. Hammer did say that the glial tissue, it's like scar tissue just for the brain, and that if a person continues to have the same conflicts over and over again, that tissue does become less functional over time. So I want to talk about the motor conflict vicious cycle. And this is common with many different conflicts, where what happens is you have the original biological conflict. So in this case, feeling stuck. The feeling stuck conflict manifests in muscle weakness and paralysis. Then you resolve the conflict and you have even more weakness, paralysis, tremors, and spasms. And because we lack an understanding of what the biological purpose of this is, and we think it's the body messing up, we think that there's something wrong with us, that we have a disease, we, then go to the doctor and have a diagnosis, and they tell us, yes, you do have this condition, or you have symptoms that seem to be in alignment with this condition, and this tends to happen to people who have this, tends to make us feel even more stuck. And so that reinforces that feeling of there's something wrong with me, I'm not okay, I'm stuck, which again will manifest in more muscle weakness and paralysis. And very commonly, there's also, on top of that, like I mentioned before, feeling stuck and self-devaluation. And so that's that feeling of I'm not okay, I'm not good enough, I'm not able to move, I'm not able to perform my tasks, I'm not able to be a mom, I'm not able to walk to my car. And so not only do we feel stuck, we are devaluing ourselves, which leads to more biological conflict, more symptoms, atrophy of the muscle. And again, we get into these cycles of healing the conflict and then going through healing symptoms. And when we don't understand what the healing symptoms mean, this can just go on and on and on. And so it's the understanding, I feel like, that can help break the spell. When you understand why the body is doing what it's doing, that there's been a biological meaning this entire time happening just outside of your awareness. When you bring it into your awareness, when you look back at the original feeling stuck conflict and all the fallout and how you felt about yourself in response to it, and you start closing these loops, you start letting it be okay that you've responded as you have, not beating yourself up, and you take this understanding and you use it to your maximum benefit. And you say, okay, well, let's see what I can do with this knowledge. Can I break this cycle? Can I stop feeling stuck? Can I take this understanding and free myself from this fear and break this cycle? I do think that this is possible. This type of conflict, again, it gets very rooted into. You start seeing, it starts being your identity as a person who has this problem. And if you can shift your identity and realize it's a biological program that was happening for a purpose, for a period of time, now it's continuing because of my responses and how I felt about the whole situation, I do believe that you have the power to break this cycle and regain your health and regain your function, which is such wonderful news. And I just want to give you that hope that I do think it is possible for people to break cycles even that have lasted a long time. So that kind of wraps it up for the details of the motor conflict. I do want to remind you of the third biological law, the compass of German New Medicine. With GNM, Dr. Hammer has mapped out an amazing science of understanding how certain tissues behave, whether they respond with cell loss or cell increase during the active phase, or functional loss or functional increase during the conflict active phase. This gives us an idea of what tissues we're dealing with and how they behave. The fourth biological law: diseases are not contagious. Bacteria and fungus are the optimizers of the healing phase. They work off instructions from the brain. And so bacteria and fungus are in our bodies for a purpose. They are helping us in very profound ways by helping to break down tissue cells, helping to restore normal tissue function. And the fifth biological law: disease is not an error. Your body is not attacking you. It's not making a mistake. It's not screwing up. It's responding. It's responding to your perception. It's significant. It's for your greatest benefit. And by understanding this language and kind of coming into rapport with our ancient biological programs, we can start to achieve greater levels of health and really that connection, the sacred medicine, understanding that your body is doing something for a purpose and kind of getting out of that mode of my body's attacking me and so I need to fight back, and just coming into that peaceful state of all is well, I am safe, my body knows what it's doing, my body knows how to heal, and restoring that sense of being on the same page with your body is such a powerful shift in perception and perspective. It's really wonderful. So I'm so happy that you watched this tutorial. I really hope that you learned something and that it helps to expand your understanding of German New Medicine and how to apply it in your life. If you are interested in even more about how to apply this to your life, that's what we do in the Resolve community. It is a place where we basically take the topic, so motor conflict, movement conflict, and we dissect it. We break it down. What is a motor or movement conflict made out of as far as in your actual experience? What are some thoughts that people who experience these types of conflicts have, and what are some difficult things to overcome, difficult things to develop a new perception of? And that's what we do in there, and we help you to have some new ideas, develop some new ways of thinking, give you tools to redirect your focus and your consciousness, even if you're in a difficult situation that doesn't seem like it can be resolved, even if you are in the state of healing where your body is still not responding to you and you're wondering, is this ever going to end? How do you respond in those moments too? Because how you feel during healing matters and determines whether or not you reactivate the conflict that kind of keeps you stuck in that vicious cycle. So, that's what we have done in this most recent month of Resolve. For May, we covered motor conflicts, so feeling stuck conflicts. And this is what the module looks like. Introduction, understanding literal motor conflicts, figurative motor conflicts, resolving, and then some really amazing exercises for moving in imagination and things that you can do to feel free, to regain your confidence. And there's also a guided meditation, a note pack, and a workbook. So if you are interested in checking out Resolve, you can use the coupon code YouTube for $5 off your first month's membership. And please email me if you have any questions. It's drmelissa@melissasal@gmail.com. I'm here. Reach out to me if you need anything or if you have any requests for videos of things that you would like to learn about. So thank you once again for watching this video, and have a great day.